Well, good evening, Windsor residents, families, friends, and team members. This is Angie. It is Tuesday, August 25th, and this is your weekly video update. So, new night, Tuesday evening. These are going to be run on Wednesday mornings at 9. On channel 2501, and of course our residents who and family members, etc., who receive these via email can watch upon receipt. So here we are. Angie's Notes, of course, has been changed to go out on Friday night. So those will be the two formal communications you will get from me on a weekly basis. A far cry away from every night videos that we were doing back in March of 2020. And we've worked over the last, I guess, several months to stabilize, etc. And as much as I'm sure you love watching my very riveting videos, I think this is appropriate for what's happening right now. And of course, as I've mentioned before, should anything come up or anything warrant more expeditious communication, you will get an email from me, you will get a video from me, whatever is most appropriate. So even though we're scheduled for Tuesdays and Fridays, you may indeed see me more. Let's hope not, because I'd like to think if you're seeing me more, it means something's changing and not always for the better. So Tuesdays and Thursdays, here we go. All right, so we will jump into tonight's update. First things first, just kind of touching on the general COVID update. Unfortunately, we did exceed 600,000 cases in the last couple of days. We are currently at 605,502 cases of COVID. Just another 2,700, it looks like, today. Deaths, unfortunately, are up to 10,500, a little over. I did take the opportunity yesterday to watch Governor DeSantis' press conference, and he did note some good data in terms of trending downwards and a kind of a stabilization of new COVID cases. As you can recall, in June and July, we started seeing numbers as high as like 15,000 cases a day, etc., which was very, very concerning, obviously. And the good news is we are pretty far away from where we were at that time. I think the cases are still too high for anybody to be comfortable with. They're certainly hugely improved from those prior numbers. So I think the big wild card right now is the kids are going back to school. Most of the kids in our kind of immediate 3 to 4 county area went back sometime between Friday and Monday, Tuesday. So we're going to see how that goes. I would expect maybe in the next 10 to 14 days or so, we'll start seeing how the reopening of schools might impact the numbers in general in Florida. And then maybe another week or two after that, if there is an increase in cases, if there's a further increase of hospitalizations and, of course, subsequent deaths. And certainly we hope that's not the case, but that's kind of in the trend, so that's what we're looking for. We also know that the Memorial Day holiday is coming up, and over the last several months, we have seen some spikes as a result of holidays and people getting together and not taking those main precautions that we're supposed to be taking, avoiding crowds, making sure we're 6 feet apart, always wearing our masks, etc. So we're just going to kind of have to wait and see how that goes. That said, we did talk, I think last week, nope. We got our test results after I did my video update last week. We had our employee test results. We did those tests last Tuesday, and we got the results on Friday. So I did put it in the Angie's Notes. So you did see a reflection in the notes that our community was, again, kind of our COVID status was positive. So I kind of say positive or negative, depending on if we have one case that we've identified in the community of an employee or staff. So unfortunately, in that testing round, we did have one employee test that came back positive. However, as you've heard me chat about recently, now that whenever we have a new case come back now, particularly asymptomatic case that has no other indications that it is positive, we have that individual go out and get a nasal swab right away. during that nasal swab. That employee went that same day on Friday when we received the results, and indeed they were negative on that nasal swab. They then went on Monday morning for a follow-up test and had a second negative nasal swab. So that is great news. Appears potentially to have been a false negative. No other indication that this employee was positive. No other individuals that had any potential exposure to that employee have had any symptoms, etc. So it does appear to be so. So we'll take it. I think it's a good protocol that we've established in terms of whenever we have a positive, sending out for confirmation. And in fact, with our last two kind of isolated positives that have come in, both employees within 72 hours, 4 days, came back with two negative nasal swabs, which of course are the most accurate. So that is good news. So while we were positive there briefly, it does appear that we are back at a negative COVID status. So that is great news. And we are still taking all of our precautions that we have been taking. And I walked through the community and talked to residents and staff, etc. And again, I'm just, what a crazy time this last 5 months has been. But to see our residents and our staff very largely working together. Sorry, Yoda's seeing some action out front there. Oh, goodness. It's Big Al getting a chair for the ladies. I couldn't expect anything else. So, anyway, goodness, I lost my train of thought. But residents have just been remarkable in the undertaking of these precautions and just really embracing them, maybe not in the short term, but in the midterm, and of course this long-term period that we've been doing this. And it is truly because of this community's compliance and togetherness that I think we are faring so well. And I'm so grateful for that, and so grateful for the encouragement of the families and friends and team members and everyone else that has worked together so hard during these last several months to keep our community safe and healthy. And I couldn't possibly say it enough, but thank you for that. So we were really excited to be COVID negative. That takes us into the next really wonderful news, which is continuing to discuss the reopening of the Veranda restaurant and the Ashby restaurant as of the 1st of September, next Tuesday. David and I, along with a couple other team members, just had the absolute pleasure of spending some time with Chef Aaron and Kel and Peter, and a little bit of time with Kelly, talking about our new reopening menu. And more importantly, getting to taste some of the new items on the new menu. And it was honestly just wonderful. It was the taste of Windsor that many of our residents moved into in the past. And I am so excited. I was excited before for the reopening of the restaurants, but I'm so excited for the experience that the residents are going to have starting next Tuesday when they get back into the dining room. They've done a wonderful job showcasing their talents, fresh, wonderful ingredients, beautiful presentation. And I know that paired with the happy residents being out in the dining room and staff that are so happy to see them, it's just going to make for some wonderful times ahead. So I am really looking forward to that. So more information will be coming out in Friday's Angie's notes in terms of how that process is going to work. So pardon me, I ate so much food and now I'm yawning. I'm sorry. That more information will be coming on Friday. So don't worry if you're like, I don't know what to do, I don't know what to go down, etc. All that information is coming. So just relax and we will get that out to you. So I'm excited. Okay. Now, What I usually do is I just kind of run through the last edition of Angie's Notes and give a little bit of a verbal update, expanding on some things. So just a reminder in terms of work orders, obviously we have a prioritization system for work orders. So obviously something that is that risks the health and safety of residents or the building obviously take first priority. Those are the things we're going to get to very quickly. Then we have something that might be technology or communication that are going to kind of fall on that second tier. And then maybe our third tier is less time sensitive. It's something like hanging pictures or rearranging something, etc. So I'm working with the maintenance team and the concierge to establish an improved communication protocol in terms of work order entry, work order tracking, and communication to residents if there's any delay in completion of work orders. So stay tuned there. But I did just want to clarify, in case someone calls with a work order, there is a prioritization system. So unfortunately, if it's getting some things hung and we have more of an emergent issue in the community, it is possible that that issue may take precedent. But my goal is to make sure that you're aware of that and that we're communicating with you in a timely manner, so that you're informed about when to expect that item to be resolved or fulfilled. Okay. Flu clinic time. Very, very exciting, right? We have a pandemic and we're going into flu season. So obviously, I know that there are very different schools of thought on vaccinations. I married an epidemiologist. There is only one school of thought in my house, and it is that of flu shots, especially as an individual who is high risk, who has a high risk child, who works in a high risk environment. I get my flu shot as early in the season as I can, as does my family. I encourage our staff members to do it. They often hear from me, guys, the residents don't give us the flu, we bring the flu to them, especially when we have school-age children or around grandchildren, etc. But always encourage our residents to get flu shots. And Nurse Linda has been amazing. This is going to be her third annual flu clinic with Windsor. We've partnered with Walgreens to bring that to you. Walgreens does handle all of the billing to Medicare and commercial insurances, so residents do not need to worry about that. Our club residents can pick up a vaccination form in the club mailroom. Village residents, that will be handled by Ali and the nurses in the villages. And of course, to our neighborhood families, I already sent out communication to you with either the vaccination consent form or the declination form. So if you could make sure to get that back to us, hopefully by the 28th, that would be wonderful. I think our target date for our flu clinic is September 10th. So please sign up. The more of us that get it, the healthier we can keep our community, because there are always a few people that aren't able to get it due to an allergy, etc. So many of us can get it. We can help keep our community healthy. That is the last insult to injury we need here in the midst of this COVID-19 pandemic. All right, so that's the flu clinic. So big thanks to Linda and to all the residents and staff that participate. All right, leftover safety. We've had some housekeepers, some servers mention that as they're going through the community in and out of apartments, we're seeing a lot of leftovers. We're seeing leftovers kind of in the fridge piling up. Sometimes we're seeing leftovers on the kitchen table, on the counters. I just want to make sure that residents know that food safety is obviously a very serious item. I do not recommend, neither does, any of the agencies I reached out to or researched, just to kind of say, what is that number? How long should we be keeping food in our homes, even if it is refrigerated? The school of thought is about 3 or 4 days. If something's been in your refrigerator for 3 or 4 days, it's time to get rid of it. Okay, we want to make sure that cold items stay refrigerated. We want to make sure that hot items are cooled properly and refrigerated. And of course, that things are reheated properly. Okay, we do not want any of our residents getting sick because we're letting food sit out or it's in our fridge too long. And a lot of times when food does have bacteria in it or other foodborne illness, we can't taste it. So we don't know it's sick. It doesn't always taste bad or off. Which I kind of assumed everything would have a little weird taste to it, but that's not the case, which makes me even a little bit more nervous. So if you feel that you just need a little help cleaning out your kitchen, cleaning out your refrigerator, let your server know or let your housekeeper know, and we're happy to bring bring something up and help you with that removal. We want you to stay healthy. We've got plenty of food. You don't need to keep your to-go containers. We want you to be free of clutter and not worried that you're going to be ingesting anything that's unsafe or potentially going to make you sick. So families and friends, if you can help me when you give your loved one a call, ask them about this and make sure that they're not storing too much in the refrigerator. And two, just remember, the more we put in our refrigerator, the harder time it has cooling, and it can cause some temperature issues, and that can also cause some foodborne illness to grow in food as well. So keep that in mind. Weekly apartment housekeeping, just a reminder, we're back at that. I do want to note, however, that we're not at that deep cleaning time yet. We're still trying to manage our the length of exposure in resident apartments, etc., because of the risk for COVID. So we are doing hard surfaces, vacuum, cleaning your bathrooms, your kitchens, etc., but we are not yet doing a deep cleaning. Club residents, don't forget, if you want your linens changed, etc., make sure to have those linens out for us, because after all, we're asking you to not be in the apartment so that we don't have prolonged exposure with you either, as part of our COVID precautions as we go forward. So don't forget to put your sheets out if you'd like your bedding changed, which we are more than happy to do. Okay. Drive-through visits are going well. We had a great visit day today. I actually came by on Sunday for the club weekend visits. David was here on Saturday for the village and neighborhood visits, and we've had some great days. And it's really fun to watch and be a part of those visits. It's so odd, you never would have thought back in January that this would be where we are, but we've tried to be creative and we've tried to find ways for people to connect. We've had some really amazing birthday celebrations under tents. We celebrated a 91st birthday today. We had a big birthday over the weekend. So we're doing our best to try to keep it interesting, and thanks to the residents and families and friends for being a part of that and helping us be creative and think outside the box and do things in new ways. So visits are Tuesdays and Thursdays as we go forward. I will go ahead and put the Sign Up Genius link in the email tonight. Please do use that. If you have any questions, though, about visits, please reach out to Cecilia. Big fun planned for Saturday. We do have our pup parade. I think at this point we have like 42 or 43 cars that will be participating. We will have a lot of hands on deck here at the community on Saturday to help participate and make that go off without a hitch. We have popsicles for our human friends and popsicles for our furry friends. So every pup that participates will get one as they leave the Windsor property on Saturday. That starts at 10. We expect to start seeing everybody arriving for the parade. Participants by about 9 o'clock into the Disney Vacation Club parking lot, like we did during the last parade. And of course, our residents, our observers, we look forward to start seeing probably around 9:30, 9:45 at the latest to get in position. And of course, we want to have our masks on all the time, and we want to be making sure that we're socially distant. So we will have chairs set up, etc. Let's see. For our visitors, just a reminder, we are going to be over at the Disney Vacation Club, but at no circumstances when we're on property. We ask that you don't get out of your cars. We are not able to offer restrooms, etc. I just want to remind everybody about that, to use the restroom before you head over to Windsor property. So I know that's crummy, but that's just where we are. Okay, we talked about restaurant plans. I'm so excited. It's going to be so wonderful. I can't wait till Tuesday when we have the opportunity to get back in the veranda and the Ashby. It's going to be great. All right. Traveling event carts. We had a fun event cart last week, which was birthdays. So I've heard a lot of good feedback about that. Residents enjoying that opportunity to celebrate together. Tomorrow's theme is back to school. So why not? It's going to have some fun treats, and CC and the Life Enrichment team will be running around doing that between roughly the hours of 2 and 3:30. So please come out and enjoy that. And I think next week's theme, Next week's theme, I think, is luau. So that should be a lot of fun. All right. Oh my. Next, and in terms of the traveling event carts, we want residents to use the common areas now. We know that residents are eating and drinking, so we do know that some masks are going to be off, but we do want you, when you are interacting with other people or the staff, as you put your drink down, etc., to please move your mask back in the upright position. Please make sure that we're maintaining a 6-foot distance, etc. That's going to be really important as we try to have more and more things in common areas that we're observing those social distancing guidelines, mask guidelines, etc. Okay. Last thing, I guess, is going to be we are in a little bit of a different position this year than previous years. I know that's a shock. I'm telling you something you don't know. Every year, Windsor participates in the Alzheimer's Association Walk to End Alzheimer's. It's always something that's been very near and dear to our heart as a community. Life Care Services as a company supports the Alzheimer's Association, all of our communities. It's just something that we do. And we've been so blessed here at Windsor to have such a high amount of participation of residents, families, friends, and team members over the last couple of years. I think this will be our 4th walk because we actually did one before we opened. That said, this year is a little bit different. This year, the walk is going to be held virtually. So we have the opportunity to do something a little bit different. Instead of us heading down to Lake Eola Park with a bus full of 10 or 15 residents, we have the opportunity to do it here at the community as a Windsor family. So we're really looking forward to starting the planning for this virtual walk that is going to be in October. As part of it, obviously, we do engage in fundraising activities. So I just want to put that out there as people become interested. This is something very near and dear to your heart. As a resident, you have had a family member, a spouse, a loved one who's been affected by Alzheimer's disease or another form of dementia. You as a family member may have a parent, an aunt, an uncle, a spouse who is affected or has been affected by Alzheimer's or related disease. And of course, people like myself who work in this amazing world and have been touched by more residents and families than I could count that have been affected by Alzheimer's disease and other related disorders. And, for me, that would be one of the most amazing things in the world would be for us to find a cure for this very painful and difficult and challenging and heartbreaking disease. So every year I work with my family to fundraise for the Alzheimer's Association, and we hope that some of you may choose to join us in that endeavor. If you're interested in getting more information about how you can get involved in the virtual walk, and you don't have to fundraise or give money to walk, or you would like to get involved in the actual fundraising efforts, reach out to Cecilia Sperry, CC, our Life Enrichment Director. She is our team captain for the Windsor Walk to End Alzheimer's team, and she will provide you more information. But we are just kind of getting our motor started on that. In fact, we are going to be celebrating the kickoff of our Alzheimer's campaign on the 14th of September. We are going to have a theme day called Make Memories Matter. That is the first day of National Assisted Living Week. So why not make it all about the Alzheimer's Association? So unpack your closets, find all the purple you can, and we are going to have a great day kicking off those fundraising activities and celebrating the start of our campaign as a community. So much more information to come, but something that is very important to Windsor as a community and to many, many of us who live, work, or are involved in some way with Windsor. So I think that's it for this evening. I know that was a little bit of an update, a little bit of a long update, but nonetheless, a few things to cover. I look forward to seeing everyone here as we move forward. Thank you again. I almost forgot we have birthdays. Real quickly before we jump off here, I want to wish Dino a very, very happy 91st birthday. Dino, he's like Prince or Cher. He only has one name. At least that's kind of how I refer to him, as Dino. Dino's a resident in the Villages and is just a wonderful human being. And today he celebrated his 91st birthday and got a horrific rendition of Happy Birthday to You from myself and a few other team members. So my apologies, Dino, but happy birthday. I hope you enjoyed it. Next up is the amazing Bob Howell, who will celebrate a birthday on Thursday, the 27th. Bob, I look forward to seeing you and wishing you a happy birthday. And last, but certainly not least, we do have a team member birthday coming up in the next few days. Want to wish a happy early birthday to Beverly Fearon. Beverly Fearon is one of our very original team members who has been working with us in the Windsor Memory Care neighborhood since we opened back in 2018. So a big happy birthday to you, Beverly. I hope you have a great day. I hope all of you have a wonderful birthday. It's going to look different than it has in prior years, but hey, it was another trip around the sun, and we're going to make the best of it. So happy birthday to you. All right, everybody, that is it for this evening. I will plan on seeing you next Friday, hopefully not before. Next Tuesday, hopefully not before, but you will get an Angie's Notes from me delivered on Friday night via email or Saturday morning in hand. All right, everybody. Thanks so much. Have a wonderful evening.